on the side of the bed that is your dominant hand. So I'm right-handed, I want to be on the right side of the bed, okay? If you have, and I think we said that earlier, if you have a patient who is large, you might need help, okay? A good practice, I think, is to kind of go in, if you don't know the patient, kind of look at your patient, talk to your patient, kind of think in the back of your mind, am I going to need help? You can wash your hands, put on some clean gloves, and just let the patient know, do pericare. Right, well there you go. You could do pericare first, or if they don't need anything, you can always just say, I just need to take a look down here, you know, this is what the plan is. The doctor wants me to put this catheter in your bladder, and kind of explain that to them if they don't know what that means. A lot of patients are like, oh, I hate those, I've had one before. But if they don't know what it is, explain what it is. And make sure that they're okay with it, okay? So always want to come in the room and be prepared. We talked about having, is this bed gonna go up? We talked about having an extra kit, an extra pair of sterile gloves, or if you're like me and you have to bring your own sterile gloves anyway, maybe 2 pairs of sterile gloves in your pocket, okay? So my patient is very thin, she's very agreeable to having a Foley placed, and I think that I can do this without any help, okay? So I've already explained to her, I've already washed my hands, I've cleaned her up. I'm gonna open my kit. And you guys can have the table whichever way you want. I like to kind of be standing right at their hips, okay? You saw me put the bed up to my waist so that I'm not bending over any more than I have to. I would have a garbage right here. This is my garbage right now. So my kit is sterile. When we have a sterile package, which way do we want to open it? Away from us first, right? So I open away, one side, the other side. If I can get it towards me. And then I'm going to grab underneath and I'm going to turn it, because I don't want this big corner right here. I have a stomach, okay? Even really skinny people have a stomach of some sort. I don't want to lean on it and contaminate my sterile field. So once I have my kit open, and I can touch the very edge, right? Try to keep it all open. I'm going to let my patient know that I'm going to uncover her, okay? Because once I put on my gloves, I can't touch anything else. So it takes some practice to kind of figure out when and where you're going to do stuff. So I'm going to let my patient know, I'm going to uncover you now. I'm going to uncover her. We never took this out. This is a good idea, you guys. This is a fracture pan. This is a kind of a nice way to get your patient, female patient, at an angle where it's a little bit easier to access, okay? So it's a good idea. Use it upside down. Put it underneath their backside. It kind of just helps them open up a little bit, right? So you have to make sure that your patient knows what you're doing step by step. And let her know, I'm sorry, I'm gonna have to leave you uncovered for a second. I have the curtain pulled, I have the door shut, right? So at this point, right on the top is a pad. This pad is shiny on one side, not shiny on the other side. This is to catch anything that might spill. You don't want the shiny side up, because what happens if I put this side up? It's gonna roll off and make a mess up underneath her back instead of right at her bottom, right? So you want the other side up. Plus it's not gonna stick to her so much and it'll be a little more comfortable. And you know, you can just ask her to lift up or whatever. And put that there. The next thing here is my gloves. What do I not want to do with my sterile field?
On your back, so yeah.
Right? I don't want to turn around. I gotta be facing it. I have my gloves. I also have this. I'm just gonna set these right here. I don't know about y'all, but I only ever use this fenestrated drape on a male. On a female, I feel like it tends to get in the way. I'm not sure if it's on your checkoff list or not. Go by your list, okay? But I don't use this drape for a female. For a male, I do.
I don't know too many nurses who do.
I don't either.
On the male, it will stay in place. On the female, it has a tendency, especially if they get a little uncomfortable and they
Start
will
to
jerk a little bit. It slides down
It's
right over the area.
practically impossible for me anyway. It just says it on the mail? Yeah.
It's a good experience.
I have used it.
You have?
But oftentimes, if I use it for female, I'm using it just to provide some extra privacy for
Mhm.
it.
So I'm gonna put my sterile gloves on. And hopefully a pair that fits. Cause I didn't grab enough for a pair.
Another pair?
No, I'll get one. They're a little big. They're okay. So I'm sterile, right? This is garbage. I can still touch the inside of it. It's gonna go in the trash. Now, I can touch all of this, all over it, if I want to, okay? So here's how I do it. Remember there's a 1-inch margin where I don't want anything to be on, right? Not considered sterile. But I'm gonna open everything up. And I'm gonna get everything ready. This is povidone, iodine. Again, Hibiclens is kind of the new thing. Whatever you have in your kit, as long as they're not allergic to it. In this kit, I have some tweezers and cotton balls. So in this case, I'd rip this open, pour it on my cotton balls, and this goes in the garbage, right? Only my hand would not go beneath my waist. I just contaminated my sterile field right there, okay? That's why you have a second set of gloves. I'm also gonna open up my lube, and I'm gonna put that in one of these little spots. Sometimes they're gonna have a thing like this. Sometimes they're gonna have a little plastic squeezy thing that you squeeze in there. Whatever they have, it's lube, okay? So I do that, and I throw that in the trash. I'm gonna come over here, I'm gonna look at my catheter. We used to be taught to check the balloon. I don't have to check the balloon anymore. It's not standard to do that. But what I'm gonna do is set this, lubricate the end of this in my lube, okay? And I'm gonna sit it back in here. I'm gonna take my syringe. This has probably sterile saline in it. And I'm gonna connect it right here. Now I'm gonna show you guys, I just said we don't have to check it, but I'm just gonna show you what it looks like blown up, okay? So this is 10 mLs. This is what's inside the bladder after you put this in. All right? Now, I want you to watch what happens if I don't take this syringe off. It sucks right back out. So one thing that happened to me when I was a new grad is I put that foley in, it was a girl, and I was all proud of myself because I had that foley in, and I started attaching the stat lock, and the foley went and slid right back out because I didn't take the syringe off. So make sure after you fill that balloon up, take the syringe off, okay? It'll only happen to you once. You won't forget again because your patient gets a little angry when you gotta put a new one in, all right? So, I lubed it. I've got my syringe attached, okay? Everything's set up. I'm gonna come over here to my patient. I'm gonna tell her, you're gonna feel me touching, I'm gonna clean you up, okay? I'm right-handed. So what hand am I gonna want to have sterile?
Your right hand.
My right hand. So I'm gonna take my left hand, I'm gonna touch, and I'm gonna spread her labia apart. I'm gonna let her know as I do it, what I'm doing, right? In this kit, because I have the tweezers and the cotton balls, how do I clean? Who watched the video? One swipe, right? Throw it away,
Trash.
get a new one, swipe on the other side, and I have like 5 or 6. I would probably use them all. Now, it's not just one swipe down the middle. Yes, if you only have 3 swabs, that's what you're gonna do. If you have a bunch, clean it. Get all the bacteria out of there, okay? Now that I'm touching her and that hand is no longer sterile, I'm not gonna move it. It's gonna stay right there, okay? So she's clean. If I would have to get a urine specimen, I have a cup in here and a label. So I would have this open and set up and ready, okay? This is sterile, all of it. Now I could have moved it over before I started, but I didn't. That's okay. I can still do this. I just have to be careful how I'm moving it. I don't want to touch the bed with my hand, right? So I'm gonna bring this whole box over, and you can't always do this, guys, but if you can, it's so much helpful. I'm gonna bring the box over and put it between her legs. I didn't touch the bed, I kind of let it drop. But now I have less to worry about with my catheter. if I'm trying to pull this catheter with all the tubing and everything from over here, what are my odds that I'm gonna contaminate it? A lot higher. Now, if you have a patient who's confused and wiggling and whatever, you probably can't put the box there. Take your risk about pulling it. But if I have somebody who's with it and okay and good, this is how I do it, okay? So I'm holding her labia apart. I have everything all set up right here. And I'm gonna, without lube, it doesn't fit very well. I would advance this, okay, until I see urine. And then what?
Disconnect that, push the bolt.
Not yet. Once I see urine come back in the tubing, I'm gonna see urine right here, right? Once I see urine come back in that tubing, I'm gonna advance another 2 to 3 centimeters.
Okay.
Because
Does it make sure go into being, it can be pushed out, so you wanna make sure it's in the.
you could have urine that has accumulated like in the urethra. We do not want to open that balloon up in the end of the urethra. Right, so we want to make sure once we see urine that we go a little bit further for a female, okay? Once I've gone a couple more centimeters, then I would instill this in the balloon and I would take it off. Then I can let go, okay? I'm not gonna, because it's barely in there. At that point, this kit doesn't come with a stat lock, but if I was using a stat lock, I would use the skin cleanser, put my stat lock on the leg, and make sure that she's got slack. We don't want a ton of slack, so it's like hanging like this, but we want her to be able to move her legs and do what she needs to do, get out of bed without, if you had this no slack and she tried to move her legs, what's gonna happen? She's gonna pull on it, right? Not probably gonna hurt. She might pull it out. You don't want that. So make sure she's got some slack. And then we're gonna clean her up. What are we gonna do with this Foley bag?
Gotta hang it.
Gotta hang it, right? On the bed rail?
No.
No. Down up underneath the bed, right? On the bed frame. We want to make sure. I'll just pull it right back off. We want to make sure it doesn't have any kinks. That it's hanging on the bed frame. And then we're gonna clean up. Clean up our stuff. Get rid of what we don't need. Clean her up. Take this out from underneath her. Make sure she's comfortable, that she's not having any problems. Ma'am, is there anything else I can do for you while I'm in the room? Take my gloves off. Well, I mean, I would have already had these off, right? Wash my hands, cover her up, give her her call bell, lower the bed back down, and document Foley placement, how she tolerated it, what French tubing it is, how big the balloon is, and if there's urine return, color, consistency, and amount. I can't smell it. If I needed a specimen at this point, I could get it from the bag, right? You have an hour to get a specimen. If not, I don't need this cup, it's just extra. Questions?
Can you fill the balloon up with air or water, or just, or you want it with water?
You want to use water.
You kids who can only come with a syringe.
They I think every kid I've ever seen has a syringe full in it.
Okay.
What you won't see always is this. Sometimes you'll see like that In-N-Out calf kit that has the sticks in it. They don't all have sterile gloves because they don't all fit everybody, right? So, but typically they might look different, and sometimes some places don't have kits. Sometimes you have to grab everything yourself. You might have to grab a bag, you might have to grab, the catheter, everything separately. And then you're really sitting there thinking, okay, what do I need for this? Kit's a lot nicer. You get a little spoiled when you get used to the kit.
Lots of different companies that manufacture those kits, but what the package contains is written on the front label.
Mhm.
So you can look and see exactly what's in it.
Yep, just read the label so you know. And then also the label's gonna tell you if it's latex and whatever the cleanser is. So if they're allergic to iodine and it's got iodine in it, or povidone or whatever, make sure you grab Hemocleanse and stuff.
It should tell you what your catheter's made of and what your gloves are made of. So you'll know if you've got a latex allergy issue for either the patient or the staff members
Yeah.
who are helping.
And
They'll have that info.
it might not say latex free. It might have this little latex thing and just have a slash through it. This one is latex.
me see.
See the little triangle
Oh, yeah.
right there?
Mhm.
So this one's not latex free. I know I had a kid earlier that was, cause we had a student that had a latex allergy, so.
I do.
You do?
Well, very mild, but. I
Well,
have-
so look at yours before you open it, cause if it's not latex free, we'll switch it out with something else. Anything else? Any other questions? Okay, well, you guys need some time to practice.